Welcome back to another episode of Right Here, Right Now with Archita. As we continue to debate on how our children are affected by the COVID crisis, the huge impact on children with special needs and their families is undisputed. Children with disabilities and their families heavily depend on the currently shut school system and public services to navigate their already challenging lives. My guest today has been working for over 2 decades in the Bay Area as an advocate and educator for families with special needs children. Eileen Crumm is Executive Director of Family Resource Navigators, a nonprofit based in Alameda County, which provides a range of services to such families. Eileen is concerned if the system doesn't get back on its feet fast enough, the long-term impact on special needs population is going to be critical. Let's hear it from her.
My name is Eileen Crumm. I am the Director of Family Resource Navigators. We are a family-to-family agency that serves Alameda County. That means we are all parents of children with disabilities, delays, and special healthcare needs. And we have come to this work in order to share what we know with other families. So FRN began in about 1992, I believe, and we've been serving the county for almost 30 years now. And we help families with all kinds of things. We are different because we first are all family members, and we are different, secondly, because we help families connect to all kinds of resources. Other agencies might help with healthcare or help with regional center. We help with everything. We help with disability-specific services. We help with school district and special education. We help getting healthcare services. We help with recreation. And as much as we can, we also help families with basic needs like housing and food. So we're different in that we are family members ourselves, and we are also different in that we take this wraparound approach to trying to help all family members to the maximum extent possible.
The impact on a family is huge. So one of the things FRN did was we decided to do some fundraising, and we did that in May to get some gift cards for families. And we collected a ton of different stories as we were giving people out these gift cards to let them know kind of what was happening. The funders know what was happening and how appreciated what they were able to do was for the family. So we had, for example, one dad who has 3 kids with special needs. And he was saying how the uncertainty is so hard. He's trying so hard. He's lost his job. He's trying to take care of his 3 kids. He's a single father. And he's really worried about what's going to happen from day to day. So we're trying to help him get connected to services. And there's a frustration because he's trying to get food aid. He's relying on the food bank. He has 3 young kids. Going out to the food bank, for the most part, means you have to go there, which is tough with 3 kids in any state of the imagination. And he is trying to get connected to CalFresh, getting the correct documentation, getting things in. That's what we were helping him with, right? Because that's what he needed. Other families are afraid because they're so afraid that their kids are so vulnerable. We have another mom who I know hasn't really left her house, right? Because she's so afraid. She has 2 kids who have medical needs. They are both very vulnerable to any kind of issue. They've had multiple surgeries, and she doesn't want to leave her home, right? So she's feeling very isolated and very pressured. So, this is family after family. We have other families who are homeless, who, even though you're not supposed to be able to get people out of their homes right now, people are getting out of their homes right now because they didn't pay their rent. And so we have 2 families that we're looking for housing for. So the the issues are immense, right? And this intersection of disability, poverty, and then, you know, all the issues of around systemic racism for families, for people who are brown or black here in the county. All of this creates a tremendous situation of pressure and trauma. And, you know, that's really what's going on for most of the families we're working with. So, you know, they're grateful for what they get. They're grateful to move forward. They're grateful for any help. But they really are facing things that no one should have to face. I have heard of 0 cases in my county in our caseloads where people are going into the homes. So that one of the models that we've heard about is like a small bubble, right? Like they're doing for preschools and other places, that it's a limited number of families in small groups. I have heard that they're doing that in Novato and in other places in the North Bay, but I have not seen that here yet. Many of the families are very frustrated because what the school districts in some cases have said is we are, you know, whatever we're doing is good enough right now, whether or not it works for your child. So that's the attitude that's not going to work. Now, are there kids that may be able to have distance learning that works? Yeah, but it's going to have to be very engaging, right? It can't just be the lecture format. It can't be we call it drill and kill, right? Question, 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 question. You know, can you answer it correctly? That's not going to engage kids who have difficulty learning to learn more. So this openness to new ways of working and new ways of doing things is really, really important. Now, that being said, I have some friends who are Facebook friends of mine that we've been having some chats online, and one of them put up something along the lines of, what are the models that work? You know, what are the things that help families? And they invited family members and other teachers, professionals from different things. And so you got this tremendous amount of discussion going back and forth to saying, well, I've heard this works. Well, I've heard this. I've tried that. And, you know, these teachers, 2 of whom I know quite well that I've worked with over the years, they were both like, okay, great. I'm going to try that. I want to do this. I want to do that. So it's not that you have people who don't want to help our kids. They want to help our kids. It's figuring out the how and getting the models out there that work and keeping everybody safe. But are they in the homes right now helping with kids? Adults with disabilities have caregivers, from what I've heard. People who have nursing help, the nurses are coming in, from what I've heard. Those are the only people. I have not yet heard in our county of any educators going in. And as I said, in the Bay Area, I've only heard that I've heard they're starting in West County, which is in Contra Costa, and then I've heard the 2 of Marin. There may be others, but those are the only ones I've heard of so far. So I'm really interested to find what happens, because it would be great to find models that work and be able to share them with other families. My parenting journey started, I was a professor of political science and research methods, and I was pre-tenure, and I was getting older, and I decided that I wanted to have children, so I did. Not something that academia really encourages, we'll be honest about that. And for the first 6 months, things seemed okay. My child seemed very fussy, but not unusually so, and we were brand new parents, so we didn't know. But it was clear from his inability to regulate and do some other things that there were some delays. He started getting services at about 9 months, which I now know is usually an indication that somebody has some significant problems. And I kind of made the changeover from being mom to being advocate, and then doing it in the community, because people would look at my child, and he has cerebral palsy, and they would decide that he has every other disability as well. And he has communication issues, and he can't move his body very well, but he is smart as a whip. and people would assume that he also had intellectual disability. If he did, I would love him just the same. But you don't assume things about people just because they have one issue, and that is something people tend to do. And I remember when he was 3 years old, people telling me that he was going to have a life where, he would be lucky if he could learn to read, and he would be lucky if he could do this. And the expectations were so pitifully low. And people live up to their expectations. Children live up to their expectations. So one of the things that I found really important to do was to have high expectations and let him discover for himself who he wanted to be. And at that point, the people I was working with from the school system wanted to determine who he was at 2.5. And that was the day I became an advocate, right? Because that was the day when I said, how can you decide somebody's life at 2.5? And so now we get to support here at other families, and we work with a lot of young children. We work with about 800 under 5, under 3s a year, actually closer to 1,000. And so I get the chance to help other people dream their dreams for their kids without somebody saying that's impossible. Kids figure out whether it's impossible, but at 2.5, dreams are that, they're the path for your life. And you want somebody to choose their own path and not be told, hey, your path ends here, this is it. And that really is what got me to leave academia, become an advocate in this world and work in this world. The fact that people need to determine for themselves, either the youth for themselves or the families for themselves, the path their children are going to take. And it shouldn't be cut off because they have a difference.
Thank you for walking us through the challenges, and we've heard about the journey so far during these really tough times. Now, let's talk about call to action. And what does the special needs community need right now?
The special needs community needs a lot of the same things everybody else needs, right? They need to have an idea of what's going to happen next. They need flexibility from the schools in figuring out how to serve their kids. They need communication of people who have great models and sharing that information for them. And honestly, they need their friends to reach out to them. This is the time when it's really easy for people to get isolated. And I think if people can do that, if they can reach out to their friends and say, can I drop something off to your house? Because you have a child that is much more vulnerable, and I'm okay doing that, right? So one of my neighbors left me a note on the door that said, hi, I'm here. If you need anything, let me know. My yoga teacher called me and did the same thing. Hi, let me know, all those kind of things make you feel loved. They make you feel appreciated, and it helps you get through the next day. So those are things I think kind of immediately people can do. They can help other people. They can try to do what they can for their community. For the schools, they can try to be more flexible, right? And all of us can try to communicate things that work so that we share that information. And then, kind of for me, the big thing would be to encourage people to refer their kids and to encourage other people that if somebody is talking to you when you're reaching out and they're concerned about their toddler or they're concerned about their child and their learning, to get help, right? The stigma is huge. The ways that we had of connecting people through physician's office and through preschools and through schools, they're not as active anymore. So we need each other to support the families to get the help they need, to refer them to places like us so we can connect them to the services that are there. So those are the places people can help, right? And these are all doable things. And if you have some extra money, which most of us don't, but if you do, you can donate to places like us. And there's an agency like ours, all of us are a little different, in every county in California, right? So the people can help the other people, because as we talked about, the other thing that many of the families we work with suffer with is the issues of poverty, right? In addition to the issues of disability. So, help people cope by doing those sorts of things. And we just had a big giveaway where we gave away about $8,000 of gift cards to people.
And what does FRN need now to specifically help such families? I know you spoke about the needs, but do you have any specific areas that you want to focus on?
So we've been having giveaways for families, and we're always really happy to have people help us to do this. So we have one giveaway that is about to happen that is for tablets for families that don't have them. So we worked with some partners in the community, and we have 40 tablets that we're distributing this week. So that's a great thing to do. We have, the room I'm sitting in is filled with boxes because we have PPE in here, right, that we're giving away for families. And we've had 2 PPE giveaway days, right, already. So there are definitely ways that you can help if that's something you want to do. If you want to help volunteer to help us do this, please, there's a volunteer thing on our website. We are glad to have people come in and help us to do our giveaways, but we are really trying to focus on getting the resources to the community, to the people who need it, to the clients that we've worked with. And so that's been a really important thing to us. So volunteering, donating, doing those kind of things, those are all really helpful. And getting your friends and your family members to call people like us if they have a child in need. Because our services are free, right? Free. Right. All the people that we talked about, before funding us, they fund us to freely serve people. And so we can help people get a lot of the things they need if they have a child with a disability or delay. So I really want to get those new families in. So that would be a great thing as well.
What a great service you all are doing. This is, as I call it, the entire cycle of goodness. And definitely we can do the least we can do is raise awareness. What would you like to see change in the education system that would help special needs kids and families navigate such challenging situations better?
Special education is a beast into itself, is the honest answer. It's really, really difficult for families to navigate. It's really frustrating. And it's really been a problem. So there's actually more money coming to special ed this year, which is remarkable and wonderful, and hasn't happened before. So if there's one thing that people can do for special education, they can support full funding of it, right? Because one of the reasons it's so hard is that teachers are always trying to think about, how do I fund this child and this child and this child? And people are pitted against each other because we don't have sufficient funding. So particularly in here in California, we're hurting, right? And so when you're hearing about funding for education, be supportive of it, and particularly be supportive of funding for special ed. That would make a huge difference.
Such a pleasure talking to you. I think we went over all the points we had. And thank you so much for your time and the service that you provide to this community. Really appreciate it.
Thank you. For those of us who do this work, it's really a wonderful thing to give back to families, right? It's other people helped me, and now I get to pass that on. So that's why we do this. We always think we want other people's lives not to be as hard as ours were, right? And that's what we're trying to do.